Hello and welcome to the first Hospital Management Asia webinar session. The session today is entitled Improving the Patient Experience and Outcomes with the Language of Caring. Today's session will be presented by Ms. Wendy Leebov. She's an author, thought leader, and expert on improving the patient experience. Just a quick reminder, if you have questions, you can type it in the chat box on the right side of the dashboard on your screen. Ms. Leebov will answer your questions at the end of the presentation. And now, to start the session, please welcome Ms. Wendy Leebov.
Hello there. Thank you for tuning in. Thank you, Rose and Health Management Asia, for sponsoring this webinar. I would like to discuss with you what I've discovered to be a breakthrough approach to improving the patient experience, and with that, the clinical outcomes that patients experience in our caring hands. Just a bit about my background. I am the managing partner of caring in the United States, and we partner with healthcare organizations to create and sustain healing experiences and positive outcomes through powerfully effective patient communication. Our specialty is communication. And I'd like to talk with you today about breakthrough approaches to communication. As you well know, we have a lot at stake in improving the patient experience. We have our missions driving us. We want to create comfort, healing, and support so people get the best possible results. We want patients and families to respect our services and recommend and speak highly of us in their communities to their family and friends. We seek professional gratification. We're doing caring work, and we want to feel the satisfaction that comes from contributing to other people's well-being. And of course, we also want the best possible outcomes for the patients and families that we serve. So I'd like to discuss two approaches to strengthening the patient experience. I call one the shotgun approach and one the bowling approach. In the United States, we have a survey that patients complete after they have a hospital experience, and it has several items about how we manage their pain, the noise in the environment, whether we've kept that under control, how attentive nurses are, how well doctors listen. It has a whole series of questions on asking patients to rate their experience. And what many organizations have done, which I call a shotgun approach, is to take one of these topics, one of these service factors, and focused on one at a time, trying to make improvements. So people will work on communication around pain, and they'll work on reducing noise, and they'll work on improving physician communication and explanations. And while they've achieved many improvements, they often overwhelm their healthcare team by so many initiatives, so many different projects going on at one time. So that's why I call it the shotgun approach. They're taking aim at one topic at a time and trying to make improvement. And that's in contrast to the bowling approach. With bowling, if you hit the center pin in its sweet spot, then all of the other pins are impacted. And what I've found is when we focus on communication of caring as one single objective, that is the center pin. And if we make improvements in communication of caring, it affects all of the other service factors that matter to patients and families in their experience. So caring communication is the breakthrough approach. And of course, people enter healthcare because they care. So as far as I'm concerned, caring is a given. But what is not a given is communicating caring. Some people, many people care, but so much is going on for them that their caring does not come across. So we can achieve by changing the way, by including in our conversations caring, expressions of caring. And that's what I'm going to focus on today. And the terrific thing is by focusing on caring communication, you achieve improvements in patient engagement, in patient safety, employee engagement, ratings of your services, outcomes. You reduce risk and improve teamwork. So there are many, many benefits to focusing on caring communication. Now, patients, of course, and families are vulnerable. They are always wondering, can I trust you? Will you listen to me? Can I do what you expect of me? Am I safe here? Can I relax, feeling great support and minimal anxiety? The Dalai Lama said, real care of the sick does not begin with costly procedures, but with the simple gifts of affection, love, and concern. And that is what caring communication is about. We have strong roots as caring people who want to make a difference, and yet these days many of us are so busy, loaded with busy schedules and multiple priorities, that while we care deeply, we run the risk of missing opportunities to communicate our caring to patients, families, and each other. So in this webinar, what I would like to do is show you how to use the language of caring so that you balance task-oriented communication with emotionally communication. And I'll also identify tactics for engaging your staff, your coworkers, in using language of caring skills every day. So first of all, the language of caring helps us balance task-oriented communication with emotional support. Now, let me ask you this. If a patient cried out to you, I'm in terrible pain, I want more medicine now, what would be your first response, the first line coming from your mouth? I'm in terrible pain, I want more medicine now. Let me explain a communication model and then go back to that example to analyze it. As I see it, there are two kinds of communication, heart and head communication. When we communicate from the heart, it's emotional, it expresses caring, it shows empathy. It's the subjective side of people's experience and our own. When we communicate from our heads, we're talking about tasks, information, analysis. We're giving explanations. We're asking questions. We're providing remedies and discussing plans. So that's the more cognitive aspect of communication. And the fact is that these days when people are very pressured and have many responsibilities, not just at work, but in their lives in general, most communication ends up being from the head and much less from the heart. And the result is that patients may view us as uncaring and not tuned into them. So heart communication needs to balance head communication. Now back to our example. I'm in terrible pain, I want more medicine now. If you responded from your head, you might say, well, how would you rate your pain from 1 to 10? Or you can have more medicine in 20 minutes. Or it's not time yet for your pain medication. Or tell me more, where is the pain exactly? Those are examples of head responses expressed by someone who wants to fix the problem, a good person wanting to fix the problem. And many of us are fixers in our healthcare roles. If you responded from your heart, you would say something like, I'm so sorry you're in pain. This must be very hard for you. Or, I'd like to help you so you can feel comfortable. So the heart and head responses are very, very different. And the fact is, both head and heart have benefits. When we speak from the heart, patients, families, and coworkers feel important, cared for, and understood, and they can hear our task-oriented messages much, much better. When we speak from the head, people get and give valuable information, and they appreciate our solutions, our answers, our remedies. So both are very important. Now, what's the ideal? The best practice is what I call the heart, head, heart sandwich. You start with heart, you move to your head message, then you end with heart again. So in our example, I'm in terrible pain, I want more medicine now. Here's how a heart, head, heart message would sound. I'm so sorry you're in pain, I want to help. Now let me talk to the doctor and see if there's something that might work better for you. Or tell me more about the pain. Where is it exactly? Is it better or worse than yesterday? So you would ask analytical questions there in the middle around the head part, and then end with caring again. I really want to ease your pain. So that's an example of a heart, head, heart message. One more example, let's say between two coworkers, and one says to the other, these people are always complaining and I'm sick of hearing it. So the coworker could respond with a heart, head, heart message. It is maddening when you do all you can for people and they still aren't happy. Tell me, and here's the head part, what complaints are you hearing? I wonder if there's something we can do to prevent them. And then end with caring again. I'd like to help you get less stressed and feel the respect you deserve. Now this is a real different response in that situation than getting hooked or tied up in sympathizing, yeah, isn't it awful that all these people complain, and, well, and ranting about that. So you have a very caring alternative to getting engaged in discussion and debate about these complaining people. So that's another example of heart, head, heart. Now, we've been able to identify concrete communication skills that express our hearts. And because most communication is head communication, we've found that it helps tremendously, and we get much better results if we help everyone on our teams learn the skills for communicating with heart. And there are 7 skills that I'm going to walk through very quickly. The first is, and I think this is the most important, the practice of presence, or some call it mindfulness. Richard Moss said the greatest gift you can give another is the purity of your attention. Now, what is presence or mindfulness? John Kabat-Zinn defines it this way: paying attention, undivided attention, staying on purpose, consciously, in the present moment without being judgmental. And only when you are mindful with patience will you release your innate compassion. And the good news is that presence or mindfulness is a skill we can strengthen. It's not a matter of we have it or we don't. It involves making a decision that we would like to be here now in the present moment. Quiet our racing mind. Take a deep breath. Shift to a posture of presence. Lean forward. Face the person fully. And create a tunnel of attention between you and that other person so that they feel your attention and caring. Then open your ears and your heart and tune in. And this does require us not to think about what we're going to do next, and knowing that that'll still be there. That to-do list will still be there when we finish the interaction. So presence is the #1 skill. If we're not paying full attention, people do not feel our caring. The second language of caring skill is acknowledging feelings. And with this, you use words to reflect back the feelings you think the other person may be having. And this is the most common way of communicating empathy, saying, gee, you sound upset, or wow, you look frustrated, or if somebody gets good news, I imagine this must be quite a relief for you. So these are tentative ways to reflect back the feeling that you think the other person is having. So look at this example. Let's say a nurse sees a patient in the morning and says, so tell me, how are you feeling today? And the patient replies, fine. And the nurse says, great. Well, that's because the nurse listened to the word the patient said, fine. But the patient didn't sound fine. So if the nurse just moves on, assuming the patient is great, she really misses out on what the real communication was. She didn't tune into the feelings, and she didn't reflect back the feelings. Here's how it would work if she acknowledged feelings, the feelings behind the words. So she would say to the patient, so tell me, how are you feeling today? And the patient says, fine. And the nurse says, gee, you sound a little down. Tell me more. And that would be an example of showing you're caring by acknowledging the person's feelings. Now, try it in your mind while I walk through these examples. A coworker says to you, I'm so sick of Claudia calling off from work. She just isn't reliable. Well, you could say, yes, isn't it awful? Or you could acknowledge. Or the second situation, the patient says, time for you again. I hate it when you come here because you always. Or you could start by acknowledging the person's feelings. I'm so sorry if this hurts. You sound pretty stressed from this procedure. So that would be an example of acknowledging feelings. The third skill is showing caring non-verbally. And as this picture shows, when people say one thing but look a different way non-verbally, we tend to believe the nonverbal behavior. So in this case, I doubt that any of you watching would think that these people are actually happy, even though they say they are happy. So we need to make sure that our nonverbal language is caring in addition to words. And you know verbal language, care messages. So on the phone, for instance, a person could say, I'll be with you in a minute, and they sound harassed and annoyed and impatient. Or they could say, I'll be with you in a minute. And the nonverbal behavior and tone send a completely different message. So we need to get a grip on our nonverbal behavior. And there's one best practice related to nonverbal behavior that is very, very valuable and well-researched, and that is that it's important to match your nonverbal behavior to that of the other person. And this is called nonverbal listening or attunement. So the case in point, let's say you're late. And to see a patient, well, they're probably frustrated waiting for you. So you really should approach them with a sense of urgency in your voice and in your step, instead of moseying in a relaxed fashion, because they're going to read your caring from whether you feel a sense of urgency like they do. So I'm talking about matching your nonverbal behavior to the feelings that you can imagine the person has, which is a sense of urgency in this case. The fourth, and that's the same with, if somebody is very concerned, then you need to look concerned with your face and your posture. If they're calm, look calm with your face and posture. When there's a mismatch, people don't feel heard. The fourth skill, and very difficult for people, is explaining positive intent. And in explaining positive intent, you explain how what you are doing for the patient or family is for their sake. So instead of just closing a door, you would say, I'm closing the door. Why? To protect your privacy. So with explaining positive intent, it's all about the patient. Or to a complaining person, start out with, I really want to help you. So you're putting your intent out there that is centered on the patient and shows what they are, how they are going to benefit from what you're doing. So let me explain a little further, since this is so important and so difficult for people, because people are used to doing what they do without really thinking what is the benefit for the patient. So if you just covered up a patient with a blanket, that is a caring act. If you explain, here's a blanket, that's even better. But even better is stating your positive intent. Here's the blanket. I want you to be nice and warm. Another example, you pull up a chair for a patient's family member, which is a very nice thing to do. Now, if you explain it, here, why don't you have a seat? It's more polite and friendly. But even better, how about this chair for you? I want you to be comfortable while we're talking. And I think you can hear how much more caring is communicated when you add your intention. You're expressing your goodwill and your intention to create a positive impact on the patient. And just a quick tip, it helps to emphasize your positive intent by using the words for you and with you. So instead of I'll tell you what you need to do, say I'd like to go over with you everything that's important for you to do to make sure it's very clear. I'd like to go over it with you. Or let's get you scheduled. Instead of that, let's get you scheduled. I want your next few appointments to be at a very good time for you. So for you makes what you're doing suddenly personal and all about the patient. The fifth skill is the blameless apology. And with the blameless apology, we use the magic words, I'm sorry, to show genuine regret that the person is somehow suffering. And we have to do that in a blameless way without placing blame on anybody else, the organization, the leadership, or even blaming yourself. And these words are powerful, and many people, when they are stressed and distressed, wait for us to show our empathy with an I'm sorry statement. And these are not blameless apologies. They're using the magic words, I'm sorry, but then they blame, or they imply that somebody else, they make somebody else look bad. Say, sorry, but it wasn't my fault. And you can even say, gee, I'm so sorry that happened, but it wasn't my fault. Well, the effect of I'm so sorry is wiped out by the fact that you're then defensively blaming someone else. Or let's say someone says, I'm really sorry. Everybody took longer today than usual. That's putting the blame on the rest of the team, even though you're trying to come across as the empathetic one. Or I'm sorry you had to wait. We're really short-staffed. And that's probably the worst way to apologize, because we're really short-staffed undermines people's confidence in the organization and wipes out your caring and fills people with anxiety. So what would be blameless apologies? I'm sorry this wasn't what you were expecting, or I'm so sorry you were inconvenienced, or I'm sorry it's exhausting to do these exercises. So you're just expressing that you feel bad, you feel regret that the person is inconvenienced, uncomfortable, surprised, or feeling physically exhausted. And that's the magic words, I'm sorry. The sixth skill is the gift of appreciation. Thanks, appreciation, a compliment, admiration. And this is especially powerful in tough situations when people don't expect us to express positive regard to them. So an example, a woman is angry at a nurse for not getting her father's test results to her, and she's asked her several times, and these test results are still not available. So how would you use the gift of appreciation to turn that situation around? Well, when this woman asks the nurse yet again for her father's test results, it wouldn't be surprising if the nurse said, you know, I said the last time you asked me that as soon as they're ready, I'll get them to you. And that would express, you know, anger and make matters worse and make this woman even more impatient. But what if she responded with the gift of appreciation? So the patient's daughter says, I've had it. I've asked you several times for these results. You know, I'm tired for them. You know, what's going on? Well, what if the nurse responded, you know, your father is so blessed to have you advocating for him. I really admire that, and I want to say that as soon as those results are ready, I am going to find you. I'm just sorry that it's taking so long. So you could transform the situation by recognizing that this possibly annoying family member is really trying very hard to act in her father's best interest. And by tuning in to that and acknowledging that, you are going to show your extreme caring and probably transform the situation. The seventh skill is for situations where you've done all you can and the person is still not satisfied. But yet you can't back down. You can't just do what they want. You have to hold your ground. And this is the skill of last resort, when you have to tell someone something they do not want to hear. So how do you do? Say it again with heart. You express a lot of heart. You repeat your main message, your bottom line, as often as you need to, but always with caring. So you figure out what is your bottom line message, the message that you cannot change for whatever good reasons have. And you repeat that, but every time you repeat that with caring. So just as an example, now I'm not sure whether you have no smoking in your healthcare facilities, but in the States now we do have no smoking. So and yet many patients want to smoke and they're very angry that they can't smoke. Well, how would you use the skill, say it again with heart, if somebody is pushing you to smoke? So the patient says, don't tell me I can't smoke. I've got to smoke. I'm a smoker. And the nurse says, I'm so sorry you're uncomfortable. That would be heart. And then the bottom line message is, for the health and safety of our patients and staff, there is no smoking here. I'm just sorry you're uncomfortable. So that would be an example of her bottom line message for the health and safety of our patients and staff. There is no smoking here. That's the bottom line. And then she combined it with caring messages. I'm so sorry you're uncomfortable. And, I really wish I could help with that. Now, maybe she does have some other things she can do. So let's say the patient says, come on, you don't understand. You must not be a smoker because I can't just not smoke. So the nurse could say, again, I feel just terrible about your discomfort, and I so wish I could help. I won't, now moving to a head message, what if I call the doctor and see whether there's some way to help, maybe with a nicotine patch, or I could get you some tea, and just somehow there's something I can do to make you comfortable. That would be the head part. And then back to that bottom line again, because for the health and safety of our patients and staff, there is no smoking here. And by using the care, some people call it the caring broken record, by using that repetitive bottom line statement, but mixing it with caring every single time you say it, you stay on the high road. You don't sound defensive. You don't lose your dignity by getting frustrated. And the person eventually realizes that your response is not going to change. They still won't like it, but you won't have lost your composure and made matters worse by becoming hostile, defensive, or negative. So say it again with heart is a tremendous skill for dealing with tough situations. So this is a short webinar, and what I've tried to do is share with you one best practice, which is the heart, head, heart sandwich, which is what I call it. Now, some people think the sandwich image is goofy, gimmicky, but the fact is it helps us understand the best practice is to start with heart, move to the head message, then end with heart. And the good news is there are very concrete skills that help us communicate with heart. And we need to help our teams build these skills so that their caring comes across. Again, caring gets lost in a sea of tasks and procedures, and people don't know we're caring unless we communicate our caring. By using the language of caring, we ease people's anxiety, we personalize our care and service, we earn cooperation, and we improve the patient, family, and coworker experience. So if you are in a leadership role, how can you help your team speak the language of caring? Just a few suggestions, and we have a video-based skill building program for staff called the Language of Caring, and what we've found to be effective is to train leaders, managers, or supervisors first so that they, in their interactions with their own staff and colleagues, can use the language of caring skills. And then focus on concrete skills, ideally one skill at a time so people aren't overwhelmed. So you would first teach the heart, head, heart model, and then focus on the skill of acknowledging feelings for, let's say, a month or so, or explaining your positive intent, and help people learn the skill, practice it, provide some coaching, and then go through practice activities that help people apply that skill to their everyday work. And by having a system for collecting feedback from patients and families, you would have feedback to show that you're making improvements, or to point you toward improvements that you need to make. So with feedback added to that education process, you can achieve considerable breakthroughs in employee use of the language of caring. So I would like to close with a heart, head, heart message for you. You know, I know that you do wonderful, caring work, and you want to contribute to the health and well-being of the patients and families you serve. By using, that's the heart message, the head message, by using the language of caring skills, you can make an even greater difference and feel more satisfaction and gratification from the caring work that you do. Closing with heart, thank you so much for your wonderful work, and thank you for tuning into this webinar. I really appreciate it. If you want information about the Language of Caring programs, we have one for staff and one for physicians. They're web-based, and by contacting me in any of the ways shown on the screen, I'll be happy to provide more information. Also, I will say that we will be, health management will be making available to you these slides so that you have this information, and also the information for use with your teams to help them develop the language of caring skills. Thank you very much, and I hope you have a good evening.